President Trump set to hold a news conference on the coronavirus outbreak this evening, 6 p.m. Eastern at the White House. This coming a day after government health officials warned that a coronavirus outbreak in the U.S. could cause serious disruption. We're joined now by Bloomberg opinion columnist Max Nisen. It's not a question of if, but when, Max, apparently. And, you know, obviously, if there's an outbreak that gets out of hand, it will stem panic. How does the president and government officials stop that from happening?
So I think what really needs to happen is that the messaging from the Centers for Disease Control and from the president and others in his administration needs to be cohesive, needs to be reconciled, because right now they're quite far apart. You have the president emphasizing the degree to which the disease is under control or contained, which is correct, but the CDC is making the very accurate point that given how rapidly it's spreading in the rest of the world, given the particular characteristics of this virus, it's pretty unlikely that it's going to stay that way for too long. And if the president continues to kind of diminish the potential impact, diminish the incentive to prepare, that's likely to have a negative impact on how far this disease actually travels. It's time to, if not panic, at least get ready now. And we need to have both the CDC and the president on the same page. I'm hoping that that happens at tonight's news conference.
Max, CDC funding has been cut. Does it have the resources it needs?
Not yet. So the administration is suggesting kind of a stopgap funding package in the realm of $2.5 billion. But the U.S. Senate, Chuck Schumer from New York, is suggesting that it might need something closer to $8.5 billion. Which number is going to get the job done really depends on how rapidly and how far the virus spreads in the United States, if it does. But, you know, if there is really sustained community transmission in multiple parts of the country, it's going to need more than that $2.5 billion. The Schumer number might look better as we look to kind of, you know, fund state efforts throughout the country, you know, continue to fund vaccine efforts at the level they need to be. After years of cuts, there's a lot of catch up to be paid, not just for this outbreak, but for future outbreaks as well.